Hi everyone, my name is Kim, and today I'm going to talk about a disorder that babies, that are 8 months old, leading up to maybe 2 or 3 year olds. And we all know, when a parent needs to go back to work, when they have kids. And so they would, or if they have a baby, say that's 8 months old, or a 2 year old or a 3 year old. And so they, before they go to work, they drop off the kids or the baby to the daycare. And it's very normal for an 8-month-old baby to when the baby is in an environment that it's not too familiar with, it doesn't look like it's, they're at home, and their parents leave. And so the baby, and this is natural, the baby starts crying, and just crying a lot. And it's because, they have this bond with their parents, or especially with the mother. And this is normal. And they cry and they cry, and but when their mother leaves, they eventually, one of the daycare teachers will try and grab an object or a toy or something to kind of divert the attention to that, and and to really interact with the baby, and try to get the baby focused on this toy, and generally all that crying stops, and they're having fun playing with this toy. Also with a 2-year-old or a 3-year-old, this can happen with them too. And eventually, they'll go to maybe an arts and crafts table and draw something, and the crying stops, and their attention is on drawing something, so and this is very normal. But what I'm talking about is separation anxiety disorder. This is too extreme, that 8-month-old babies up to 2 or 3-year-olds, when they're dropped off, to go to the daycare or nursery, they will cry. They will continue to cry. They won't stop. Even if their mom kisses them goodbye, pats them on the back to try to calm them down, but the parents have to go to work, and so the child is just crying and doesn't want to do any activities because they're so focused on their mother had left them, and they're just really upset about that, and they're going to continue to cry, and there's nothing that would help to kind of divert their attention to doing something fun. Nothing can faze them in that way. They will continue to cry. They won't take part in little, or say show and tell or arts and crafts or any sort of activity, or going outside to get some fresh air and to play with the other kids. That doesn't help. They're still continually crying. And So yeah, this is too extreme. Um, there's nothing that can kind of soothe them, or something, the teachers, they try, the daycare teachers, they try their best to cheer the child up, to bring a toy that they might like, or they might find interesting. But that doesn't work. That separation from either the mom or the dad, it's such a strong, it's so strong that they can't handle being dropped off, at a daycare as their parents go to work. It's stressful for them. It's to them, it's like a new environment. And they just, don't care about anything else but to have their parents with them. And even at home, they need to be in the same room with their mother, or their father. They need, if they're playing with something in the home, they need, for a parent to be there, to kind of, and not go off, like the parent, and not go off to another room or something, because then they'll just start crying, and kind of throwing a tantrum or something. So the parent, as long as the parent, they're pretty good, at home, as long as the parent is in the same room with them, but as soon as they leave to do something, then the crying starts. So all this emotional stuff can cause them to have physical symptoms, physical illnesses, say like bad headaches, or anxiety, or nightmares. Yeah. So I'm going to keep this short. But this is not normal behavior. Generally, children that are 2 or 3, they're curious, they're a little bit more independent, they love to kind of explore, explore things around the house. They can, play with their toys, as long as the parent is there at home with them. 8-month-old babies, I think it's going to be a little bit, when they have this syndrome, this separation anxiety disorder. If the parent leaves the room, the child's going to cry. So the parent will pick up the baby, pick up the baby, take the baby with them, whatever they need to do in the kitchen, clean up the kitchen, or something. As long as the baby is with their parents, then everything's fine. It's just not normal for them to, parents, in order to look after the baby or the children, they need to go to work. So they drop off the baby or the children at daycare, and so this, because they have that syndrome, this becomes so stressful for them, for these babies or the children that are 2 or 3-year-olds. Okay, I'm going to talk about how we can treat this. Now, for 8-month-old babies, the medication route, they're they're babies. You can't give them, anxiety medication for babies. You can't do that. Also, for 2 or 3-year-olds, I don't think you can do that either. They're just too young, too little. But a family therapist, can help. Can help help the parent, give them tools and give them, some tips that they can do to, when they are on their way to work and they drop off the baby, or they drop off their 2-year-old or 3-year-old to daycare. The therapist might suggest, just spending that, getting up early and spending, because babies and 2-year-old, 3-year-olds, they're up early. They're up by sometimes maybe 6 or 7. And so you get up extra early, and the therapist may recommend, to spend some time with them, read a book, or for an 8-month-old, bring some toys that they can play with, or their favorite stuffed animal that they can, hold. Just spend that time, those extra couple hours, and then, try and see, when you drop them off at the daycare, see if, see if that method works, when you drop off your child or your 8-month-old baby. And, if they seem to, they seem to be able to handle their parent, dropping them off. And, if there might be a little bit of crying, but, if they can find something, like the teachers will help them find something, a toy or something that they would enjoy playing with, or for 2 or 3-year-olds, to take them to a arts and crafts table and just really kind of have that one-on-one with that child, but of course kind of supervising the other children too, but yeah, kind of establishing a one-on-one, taking an interest, what the 3-year-old or 2-year-old is making or drawing at the arts and crafts table, or the 8-month-old, with, has brought their favorite teddy bear or something, and they've kind of snapped out of the crying and the whole separation thing from their parents, and they're playing with their favorite toy, and everything seems to be pretty good. So yeah, I don't think, therapists or psychiatrists or whatever, I don't think they're going to, prescribe any medication. I mean, the ages are way too young for that. But therapy will help, definitely, family therapy. Anyway, my time is over. I hope you enjoy this video, and I hope it's there's something that you can learn from. So I hope you guys have a good rest of your day, and I'm going to say goodbye.